Allison had now established a novel concept for cancer therapy, but several questions remained. Could checkpoint therapy be developed to cure more patients, and could it be generalized to other types of cancer? Studies that would lead in this direction were already ongoing in a laboratory across the Pacific in Japan. Actually, they had been started several years before Allison's key discovery. So we cross the Pacific, we go to Japan, and we go back in time to the point where Allison had started. And you will remember and recognize the T-cell receptor and the accelerator. Enter our second laureate, Tasuku Honjo, who in 1992 discovered a new protein on T-cells, which he called PD-1. And PD-1 is shown on yellow here on the T-cells. He did not understand what the molecule was doing, but together with his colleagues at Kyoto University, he launched an ambitious, curiosity-driven research program to understand its function. Several years of research later, he could reveal a chain of molecular interactions, leading him to conclude that PD-1 also acted as a brake, just as CTLA-4, but in a different manner. You step on the brake, and the T-cells holds back. In addition, Honjo had identified the ligand, the molecular partner of PD-1, and he found that it was expressed on antigen-presenting cells, but also on cancer cells. And now it became immediately evident to test whether blockade of PD-1 could also be used to unleash T-cell responses against cancer. So what happens when you release the brake like this? Honjo's and other groups immediately started to gather evidence for this. And here we are looking at one of the studies of melanoma, the skin cancer, and in this case it is spreading to the liver in mice. The control mice on your left developed multiple metastases in their livers, while several of the mice who had been treated with the antibody to your right had almost no metastasis at all. In this study, Honjo correctly predicted that anti-PD-1 treatment might complement the anti-CTLA-4 treatment, since the two worked via different mechanisms. He also predicted that PD-1 might give less side effects. Honjo now also turned to the pharmaceutical industry. An intensive program started, conducted by other clinical scientists, mainly in the US. Again, similar or even more dramatic responses were noted, not only in melanoma patients. And FDA approved the anti-PD-1 treatment for melanoma in 2014 and for lung cancer as well as kidney cancer in 2015. So now we have two treatments available for patients based on immune checkpoint therapy. And today we have even